everyone, welcome to the Where To podcast, where we will answer all of your Where To questions. We are here to discuss mental health and resiliency with you in order to help you live the best life possible. Let's get started.
Welcome to our third episode of Where To with PFH Prevention, where we discuss all things resources and where to find them. I'm April, a crisis counselor with the Missouri Show Me Hope Crisis Counseling Program. Today we will be discussing resiliency from a clinical perspective and how to learn more about resources offered through the Certified Community Behavioral Health Clinic here at Preferred Family Healthcare. I have Sarah Poore with me here today. Sarah, do you want to go ahead and kind of introduce yourself? Maybe tell about a little about your job, kind of what goes on at the clinic, stuff like that.
Sure. So I'm Sarah. I'm the clinic manager. I have been here for 2 years. I've been a registered nurse for about 25 years. That makes me sound old, but I still feel young at heart. We're a specialty clinic. We focus on all things behavioral health. So we see folks with kind of some mild anxiety and depression, and we see folks with some pretty significant behavioral health needs, bipolar disorder, schizophrenia, personality disorders. We kind of see all of it.
Yeah, I know during my time as a caseworker, I got to see from the internal perspective what you guys do, and it really is amazing. And people don't realize the need for this type of care. They really don't see it. So we always kind of try to do something a little silly, something a little funny, to start our podcast out with some fun questions. So our first question is, if you could live anywhere, where would it be?
I just answered this question on Facebook, actually. And so I had 7 places. So to narrow it down to one, I would probably pick Greece. I've never been there personally, but I've seen pictures. It's beautiful. I love the beach. I love coastal living. And I would like to practice as a nurse in a foreign country so that I could compare and contrast how their healthcare system is different than ours.
Yeah, it's always interesting to see how things are. Things are the same, things are different. For me, I don't know. I don't know if I have any particular place. I just love the beach anywhere where it stays warm, the sunshine. I hate when it's rainy. This past couple weeks has been pretty nasty. That's been pretty tough. I love the sunshine. So I would say anywhere that there's a beach and the sun, I'm happy.
Well, you can come visit me in Greece.
There we go. The second question is, if you could eat one meal for the rest of your life, what would it be?
I love Mexican, but I love Italian more. So I'm going to have to say pizza. And the reason for that is because I can change the toppings.
That's true.
And still have a different meal
That's
every
a good
day.
loophole right there.
You're right.
That's a good loophole. Yeah, I was on the Mexican kind of along the lines of thinking Mexican too. I do love fajita nachos.
Ooh,
I think those are
good.
Those are definitely a weakness. Okay, so kind of diving into the clinic. I know you mentioned kind of the clientele that you guys see, the people that you help. What specific services can people find here in the clinic?
We provide medication management and then therapy services. So we have 2 psychiatrists. We have about 5 or 6 master's level therapists that see patients here in the clinic. Some of those are completely virtual, so they never see a patient face to face. We have about 5 or 6 more therapists that just see kids in our local schools.
Wow.
So kind of 12 or 13 therapists in total.
Yeah, I think it's awesome that you mentioned that you not only serve adult populations, but the youth as well, because I think that's another population that kind of gets overlooked when it comes to mental health services and behavioral health.
Something else I want to say about our clinic is we have support staff, admission specialists, receptionists, nurses. If anybody out there is looking for a job, I'm hiring a nurse and an admission specialist.
Yes, absolutely.
So check out our website.
Yeah. Times are tough right now for the healthcare fields trying to be fully staffed. I know that it's definitely hard on your healthcare workers. So for sure, put that out there. So a lot of what we do is Show Me Hope. We are as a direct result of COVID. That's where our job comes in, providing coping skills, resiliency, education, stuff like that. How have you adjusted to the pandemic here in the clinic?
So COVID here in the clinic has been kind of a blessing and a curse. Definitely a challenge for our nation, for our world. But what it has allowed us to do is to be more creative in the way that we deliver services. So it kind of forced our hand to something that we were thinking about already. We are providing just a lot more telehealth services than we have in the past. We have a lot of patients who really enjoy that. What it just allows more freedom for the patient. So they're able to have services maybe in their own home. Maybe they're able to go to a private room at lunchtime during their work. They use a laptop, they use a smartphone, whatever device they have, and still receive quality services from their healthcare providers. So that's great. We do have those patients that every so often we still require them to come into the clinic because they're having a crisis, or we just need to lay eyes on them. But the telehealth has definitely been a big plus for us and for our patients.
Yeah, absolutely. I like how you mentioned, sometimes you still have those clients that need to come in and be seen face to face, because we all, it's so much more handy to have the telehealth, and we know that that's kind of the way things were going. But there's just some things that you can't see, and we all, yes, in the behavioral health and mental health field, there's just certain things you have to see the person to really see what's going on with them, because maybe they're not going to be 100% truthful, or maybe something's going on that they're not showing.
Absolutely. And there are some assessments that we really have to see the whole person in order to be able to do.
Yeah. So how about you? We're kind of always interested in, people in the healthcare field. How have they adjusted to the pandemic and how things have been going on? What have you done specifically to kind of manage that work life, stress, all that stuff?
I try to maintain my life as normal as possible. So I'm cautious of the virus, but definitely not afraid of it. I try to follow whatever guidelines are out there currently. And so those have changed dramatically over the past 12 or 14 months. So sometimes that's a little hard to stay current with.
Yes.
But I still go to work. I go to church. I go to the grocery store. I go to my kids' activities at school while trying to keep those guidelines in mind. So really just trying to let it affect me as little as possible.
Yeah, and I think that's definitely what you mentioned, is it's hard to keep up with what the guidelines are because they are so rapidly changing, and so I think that's been a lot of people's stress surrounding the pandemic is what do we do, what don't you do, what's allowed, what's not allowed.
The unknown is always stressful. I have seen a large increase in our caseloads here at the clinic. We live in a busy society that leads to stress and anxiety, but put on top of it the virus and the recent changes that have been going on in our society, and it's just a difficult time for sure.
Yeah, absolutely. I think that's definitely one thing that we can all take away from what's happening and what's been happening is the availability of care has just grown so much, and the having it normalized now, and it's okay to talk to if you need a therapist or you need to reach out. I think people they're putting that out there so much more than they would have before. So I guess that's the light at the end of the tunnel, or the silver lining.
Absolutely,
people can feel a little more comfortable reaching out and getting that help. So that's always awesome. So if you're ever feeling that you need to reach out to somebody, there's resources available. You can reach out to Mo Prevention, moprevention@pfh.org if you need some connection to the resources. Maybe if you want some more information about the clinic here at Preferred, we would be more than happy to give that to you. But I just want to, Sarah, do you have anything else that you would want to add before we kind of wrap up a little bit today?
Just really, you hinted there at the end that I think one thing that this pandemic has done is put mental health awareness out there a little bit more than it has been previously. And I think that is our silver lining. And so more and more people are aware that, number one, there's help out there and where to go for help. So please don't hesitate giving us a call if we can help you in any way.
Yes, absolutely. And we definitely thank Sarah so much for giving us some time today and kind of sharing a little bit with her experiences and, how the pandemic and everything has impacted the clinic and her personal life and all that good stuff. So we definitely thank her so much for joining us. On Friday, June 4th, you can find the Show Me Hope Crisis Counselors at the Kirksville Art Walk in downtown Kirksville from 4:30 to 7. We're going to have the prevention party in the park. As of now, I think it's going to be towards the end of July. We had a different date set up and had to kind of push it back. We do have another project going on called the Planting Seeds of Hope project, where we do have seeds available if anybody would like to have some free seeds to plant some flowers, just get outside and enjoy some nice relaxation. But if you have any questions, you can reach out to us, like I said, at moprevention@pfh.org. Find us on Facebook. But otherwise, we will see you next time. Thanks for listening.
Thank you for listening to this week's podcast on Where To. This podcast was brought to you by Preferred Family Healthcare Prevention. For more information about PFH Prevention, please visit our Facebook page at Preferred Family Healthcare Prevention. You can also find our YouTube page at Prevention PFH, or email us at moprevention@pfh.org. See you next time!